Unfortunately, fatigue is a very non-specific complaint, and it can make it very difficult to evaluate this when a patient comes to your clinic. However, one of the most important factors is actually the duration of the patient's symptoms. And so in terms of duration, we have what we call acute fatigue, subacute, and chronic. In medicine, it's very important to determine the duration of a patient's symptoms because it completely changes your differential diagnosis. So generally, for acute fatigue, this is related to an acute illness. For example, if somebody's had flu recently, or viral infection, or maybe gastroenteritis, or if they've had a recent life stressor, for example, moving or starting a new job. When you get to subacute and chronic, however, this is when you really want to start being concerned for underlying chronic medical conditions, a psychiatric condition, or medication use and toxicity. So in general, I would say acute fatigue may be related to an acute illness, and you should just give some time before you really delve a lot further. But once you're starting to get into subacute and chronic fatigue, this is when further evaluation is definitely warranted. So when evaluating subacute and chronic fatigue, a really good way to approach this is using a head-to-toe approach. So number one would be in the brain, or psychiatric or neurologic diseases, such as depression, somatization, fibromyalgia, and multiple sclerosis. Specifically, I want to say depression, especially with anhedonia, which is a lack of interest or a lack of motivation to do things. This is one of probably the most common causes of chronic fatigue. And so you really want to screen patients for depression. And so we use things like the PHQ-9 test or the GAD score to screen for depression. Next, we think about things that could be going on in the neck, and in this case, that would be the thyroid, and either you could have hypothyroidism or hyperthyroidism that causes fatigue. Moving into the chest, we have the heart, and specifically, we think about cardiac etiologies such as congestive heart failure. And we've also got the lungs, so we think about pulmonary conditions such as COPD or sleep apnea. In the abdomen, we have the kidney, and you can think about chronic kidney disease and uremia. And you also have the small organ on top of the kidney, the adrenal glands, which can cause fatigue by the way of adrenal insufficiency. In addition, we also have the liver, and in patients with cirrhosis, they have this chronic medical condition that also contributes to fatigue. In the vasculature, you should consider things like peripheral arterial disease, and basically this causes claudication, and patients can feel like they are having fatigue, but really it's a symptom of claudication. And then lastly, I wanted to go over through this kind of whole system-wide assessment because there's a lot of other etiologies of fatigue. So you should consider systemic things such as anemia. Malignancy is another key one. Chronic infection, autoimmune diseases, and medications and substances. So again, how are we going to screen for all of these, and what should the workup look like in terms of assessing fatigue? So again, for psychiatric conditions, we're going to use the PHQ-9 and the GAD-7 score. For thyroid, you're going to want to consider getting a TSH. And then for pulmonary and cardiac, it's really going to rely on your history and your physical exam, but also definitely consider getting a sleep study if there's concern for sleep apnea. And then in terms of kidney function, you're going to get a BMP. Adrenal, we typically don't do an adrenal workup right away, but that could also be suggested on your BMP. You could see some electrolyte abnormalities such as hyponatremia and hyperkalemia. And then a liver, of course, you're going to get LFTs. And then vascular, again, it's going to be based off your history and physical. For anemia, we're going to do a CBC. And then for malignancy, we're going to be doing routine cancer screening. So is the patient due for a colonoscopy, or are they due for a pap smear, things like that, or breast cancer screening? And then assessing the other issues is going to come down to, again, your history and what your suspicion for infection, autoimmune, or medication-induced fatigue is. Now, if all of these things are negative, then we have what's called a diagnosis of exclusion. So a diagnosis of exclusion is something that can only be made once you have ruled out all these other etiologies of fatigue. So you've already gotten all the workup for this other stuff and you can't find anything. Then you can make a diagnosis of chronic fatigue syndrome. This is also known as myalgic encephalomyelitis or systemic exertion intolerance disease. I hope this was a helpful basic outline and approach to the evaluation of fatigue. Remember, look at the duration of symptoms first, and if it's subacute and chronic, then you're going to be more concerned for chronic medical or psychiatric psychologic etiology of their fatigue. And then after that, go through a head-to-toe approach to hit all the different systems that may be potentially leading to the patient's fatigue and order an appropriate workup as indicated. Thanks again for watching. I'll see you in the next video, and peace.